This job is really hard sometimes. When I was an intern, I had that case that you kind of dream about as an intern, like sick patient comes in, immediately recognize sick patient, do my ultrasound thing, tell the fellow, tell the senior, tell the attending, everyone agrees, feeling like a hot shot, tube in, central line in, A line in, call the surgeon because we're that confident. You go to the CT scanner anyway because they need that. Everything came together immediately, perfectly. Patient comes back, surgeon down at bedside. These are intentionally vague for HIPAA reasons, obviously. But everything went perfectly. Patient codes anyway. ACLS runs perfectly. Meds in, ROSC in. So now that's 2 times that things go perfectly. Patient codes again, couldn't get them back. And I was pissed. Like, we did everything right. Like, where's my A on the test? Where's like the little checkbox dopamine, like good job, pat on the back kind of thing that I was used to my first 27 years of life before I was a resident, right? Because you always get that gratification of good job, student, right? Real life doesn't work that way. And my senior resident at the time was like, that happens, right? Real life doesn't work out even if you do things right, which is true. And that was the first patient of the day, so we kind of moved on with our day, right? But the fellow at the time said, you should feel bad. You should feel bad about that. And not in a shame sense, right? You didn't do anything wrong. You are not bad. But you should feel bad because the things that we see in this field, in medicine at large, is impossibly terrible sometimes. Despite the best intentions, despite the best work, we see some impossibly terrible things. So we said you should feel bad because those are the moments where you dig deeper than the protocol and I did everything right. It makes you think more critically of what could have been better because things could have always been smoother, right? And I had a rough series of shifts recently in another one of those cases where despite all things going well, logistically, procedurally, whatever, you still have a bad outcome. And you still need to tell the family that their loved one had passed. And I still feel just as bad now than I did last year. And I have some mixed feelings about that, right? Because as a learner, it's good to be just as driven to better yourself. And as a doctor, I think that's good for me as well. As a person, I think it's still terrible for me. Keeps my therapist in business, I guess. But like the nightmares and the constant reflecting, it's still tough to disconnect, and I don't know when that's going to change.